Joseph Walter. I graduated University of Rhode Island in 2018, and I'm currently a professor, clinical assistant professor at Rutgers Ernest School of Pharmacy.
Cool. So, what is your full title? I see you have a lot of letters after your name.
So I have my doctorate of pharmacy, and then I'm also board certified pharmacotherapy specialist, so BCPS.
Cool. And so after you graduated URI, what was your after graduation education?
Sure. So in order to get a faculty position, you do need 2 residencies. So did my first year residency at the VA in Connecticut, which was a general residency. And I knew I wanted ambulatory care after that experience. So I did a 2nd year residency specializing in ambulatory care. And I went to CoxHealth in Springfield, Missouri.
Wow. So did you know that you wanted to do ambulatory care and academia when you were graduating from pharmacy school?
Yes. So I would say I kind of knew I wanted academia my 3rd year of pharmacy school. Ambulatory care was a mix. I wasn't sure if it was something that I wanted. I actually thought I wanted pediatrics, and then on rotations, I realized I did not want pediatrics, and I wanted the opposite. I actually liked working with the geriatric population and managing chronic disease states, so rotations were super helpful in determining, my trajectory. And so then after the VA, when it's a lot of ambulatory care in the VA, I realized that's exactly what I wanted to do.
Cool. So when you were looking at different ambulatory care opportunities, what type of ambulatory care are you currently practicing in?
So I'm currently practicing, it's known as a family medicine clinic. And so what that is, it's exactly what it sounds like, I guess. So the patients in clinic, they see the doctors, see the patients from when they're born all the way, and then hopefully they keep this doctor for the rest of their life until they're geriatric. And so it's a really cool opportunity. It's also a residency clinic. So they have a residency program. So I work a lot with medical residents who are training, and it's a 3-year program for them. So it's a great teaching environment, which is awesome. Especially as a professor, we take students on rotation with us. And so they're used to medical students. And so it's a great interprofessional learning environment. And then the type of ambulatory care practice, they needed a lot of assistance with diabetes and blood pressure. And so the vast majority of patients that I assist with, I help manage their diabetes and blood pressure, and then also assist with cost issues too, because it is also a medically underserved clinic, which means that a lot of the patients either on Medicaid or don't have insurance. So it's me finding opportunities to get their meds for them cheaper.
That's awesome. So I know diabetes is one of the few guidelines that actually have a cost as a major issue as part of their.
Yes, so a lot of my job is trying to figure out how we get patients on insulin, or some of these new costly agents like Victoza or Jardiance that work a lot better than our older agents, but as we know, are super expensive. So really trying to learn the insurance formularies, and when they don't have insurance, helping the patients complete those applications to get the manufacturer to get their medications free for a year.
That's awesome. It's really cool. So what is a typical day like for you?
So for my day, I would have to do a week, not a day.
Okay.
Because the good thing about academia is that it's very flexible, because I kind of have 2 jobs. So I have my professor job, and then I also have my clinic job. And so I'm able to, so I split my day up into into 4 parts. So my main part, so for most of the days out of the week, or I'm seeing patients on my pharmacy clinic days. And so on those days, I have my own schedule where I see patients independent from the doctors, which is awesome. It's really autonomy. And I do have a collaborative practice agreement with the doctors. So a collaborative practice agreement allows me, if the patient, doctor, and I all agree, they have to sign a form. And essentially it allows me to adjust the medications for whatever disease state that the doctors refer that patient for. So in this case, a lot of diabetes, blood pressure, cholesterol. And so I see patients on my own schedule, and then I basically do my own evaluations of their sugars, blood pressures, And then I make medication adjustments, and I'm actually sending that prescription to the pharmacy under the doctor's name, and it's able to get filled. So that's 2 days out of my week is doing that. Another day out of my week is known as shared visits, which I did during my PGY2. So shared visits are an opportunity for myself and the students to work with the doctors. And so for that day, we kind of look on the schedule to see patients who might benefit from pharmacy services, but maybe not long-term. So maybe they just got out of the hospital for a COPD exacerbation. So we're going to go review their inhalers with them to ensure that they know that they're on the right inhaler, that they know how to use it, things along those lines. So it's an opportunity just to work with the doctors and see patients who might not need us long-term. Then in the other days, I have a day just dedicated to all my drug information questions that I'm getting from the doctors. Because again, in the clinic that I work in, since it's a residency clinic, I have 24 residents that I work with, as well as 12 faculty physicians that I work with. So it's one pharmacist for 36 doctors. And so you can plus all the front staff and the nurses. So there's over 60 people that I'm working with. And so all of them have questions that they're getting from patients, from insurance companies, things. So I need basically a day just to catch up on that. Also just catching up on patient phone calls too. So since I have my own schedule, I'm calling patients to reschedule them, things along those lines. And then the last part of my day or week is 1 day of admin time. So that gives me time to catch up on my school duties. So again, it's since I take students on rotation, it's doing their evaluations, doing topic discussions with my students, giving me time to work on lectures that I'm doing at school, preparing my syllabus, everything school related. So as you can see, my week is there's a lot of components that go into it, but I really enjoy it because no day is never really the same.
Yeah, that's awesome. It's really cool that you get all those opportunities. So you get to go from, collaborative practice to having those great teaching moments. Because I'm sure sometimes when you're teaching about the patient about those inhalers, sometimes you might be teaching the medical resident also about the.
Yes, it's a great teaching environment, and I'm keeping the shared visits because the residents have responded so well to it. They enjoy us going in the room with them. Plus, they have medical students there too, so it's also a great opportunity for the pharmacy student and medical student to go in together first, and then they tell us the plan. So it's a great opportunity and really a lot of learning. And they've been very receptive to having a pharmacist. They never had a pharmacist before. And so for me to, step into this role and for them to be so accepting and eager to work with a pharmacist has been really rewarding.
That's awesome. So did you kind of create your own position when you came in, or how did that come about?
So yes, they knew. So when I kind of came in, I kind of advice from previous faculty, basically the first month, I just watched just to observe. However, I knew coming in, there's something called quality metrics that kind of look in the insurance side of things. And so quality metrics are essentially a way to make sure patients stay healthy, but there's also revenue tied to it. So for instance, if you get a certain number of patients A1C below 9%, you get a higher quality rating, which then can bring more money to the hospital system. And so they knew that they needed assistance with diabetes to get their A1Cs down and blood pressure to get the blood pressures down. So that's what they know that need was. And so for me to find out the services, what else I could assist with, I just did a month, and I just really relationship building was the first month or two, because again, they never had a pharmacist. They don't know my style. I don't know their styles. There's 36 doctors. I have to figure out every single one of their styles and make sure that they trust me and build that trust. Because if they're going to allow me to send that medication with the CPA, they need to trust me. So really the first 2 months, I kind of just shadowed and was there for questions and to build those relationships. And then once those relationships were built, I proposed my schedule to the director, the medical director there, and said, hey, this meets your goals, this meets my students' goals, this meets my goals, this meets the hospital's goals. And he agreed, and then that was my schedule.
That's awesome. That's so cool. It's cool that
Yes.
you're kind of able to build that rapport and actually, start from the ground up, really, to create that. What would you say is the most rewarding part of your job?
So I would say there's probably two aspects that are the most rewarding. So the first aspect is the patients. So I really enjoy my patient panel. I've really built it up since I started there, and the A1Cs are starting to come back, and so they're starting to come down, which is a good thing. And so the patients just get so excited when they go from like a 10 to a 6 in a matter of 3 to 4 months, and because it's just really rewarding, and they get really excited, and they're starting to know me, and so they're like, "Oh, hey Joe, like, how are you doing today? Like, so I thought you, so excited to talk with you." So it's really building that relationship with patients too, and to help them achieve their goals to make sure that they're healthy. That's super rewarding. And then the other rewarding aspect is with the students now. So I'm finishing up having students. I just had students for the past 3 cycles, and to see their growth from the first day to their last day, in terms of their knowledge, in terms of because my goal is by the end of the rotation that they should be able to run a visit, know all the diabetes meds, and tell me what they need to do. And so from day 1 to the last day, you can see that progression. And so it's been really rewarding, and all the students have really enjoyed the rotation, which is good since it's brand new. So that's been super rewarding, and they've even started recommending my rotation since it's new to the next class. So I'm glad to know that I'm really helping shape the future pharmacist, which is why I got into academia. So I'm glad to know that that's happening.
Definitely. So with academia, what is you have your APPE students, and then also do you have other responsibilities within the College of Pharmacy as well?
So yes, with academia, so your professors do a lot. It's probably what you don't realize. They're not just there to teach the class or take you on rotation. And so with academia, there's buckets that you have to think about, or at Rutgers, we call them pillars. So you have your clinical site, which is your pillar. You have your teaching, and you have your service. Those are like the 3 main pillars. And so, your site is the main one where you take your students. Your teaching could be not only experiential, so that's taking students on rotation, but then also teaching lectures. And so since I'm a newer faculty member, they usually try to keep it light your first year, because really you're trying to make your APPE successful. And so that's where you're spending most of your time. But I did have an opportunity to co-coordinate a class. And so you don't realize how much goes into coordinating a class. Luckily, it's only a 1-credit course, so that makes it easier. Plus, it was 3 other new faculty have also volunteered to co-coordinate. So it's been a nice team effort. And so coordinating a class, so we met basically once a week, and we had to develop the syllabus. We had to revamp the entire course essentially. And so we revamped the syllabus. We had to develop the quizzes, the reflection posts. We had to coordinate who was giving the lectures. So it was multi-site. So we asked new faculty to give some of the lectures. We had to give some of the lectures. We asked residents to give lectures. So it's really sending all those emails behind the scenes. So even though we might not be in lecture every day, we're coordinating everything behind the scenes to grade all those assignments, things along those lines. And then service-wise, that's where your research kind of plays into a role. So developing research projects, and then also serving on committees. So I'm on 2 committees in the school, where I'm serving not only in the College of Pharmacy, but also the health system school itself, or health sciences school itself. And so I'm part of the student advising committee. So we have to attend those meetings, develop those protocols and whatnot. There's a lot that goes behind the scenes, not just your APPE.
Yeah, definitely. What was the class? Like, what was the?
Oh, so it's a freshman year class, so pre-professional year, freshman year. It's spring semester course, and it's called Pharmacy Convocations. Essentially, it's an introduction to pharmacy. And so what we did was the first half, so before spring break, was really what is pharmacy, what is healthcare, what are some pharmacy organizations, what are basic pharmacy laws, just really what is pharmacy. And then the second half, we decided to think about, okay, here are all your career options. Here's what pharmacists are doing, and here's what residency, here's what industry is. And so really the goal by the end of the class is to really, since they're freshmen, if you don't think this career is for you, this should give you a basic understanding and whether or not you should continue into the program or maybe transfer your major because freshman year, because you still have another 5 years to go. So that's really the goal of the class. So it's really exciting because it's been different because of Zoom, but I will say the students are super active on Zoom and they're always in the chat, asking questions, staying engaged. So that's been a nice way. It stinks that we can't see them in the classroom, but it's been nice that they're staying active in the chat.
Definitely. That's super cool. I wish that you or I had a class like that. Maybe someday in the future.
Yes, I think when I heard about this class, I said, whoa, this is pretty awesome, because a lot of stuff you don't realize until maybe your P1 year.
Yeah.
And so to have it in your freshman year, I thought that was a really great approach to the curriculum.
Yeah, that's awesome. So what was the when you were looking at your like going into pharmacy in general and like what career avenues kind of thing, when you were looking at residencies, were you aiming more for like ambulatory care kind of things? Or because I know you said that you wanted to do academia and you liked am care, so were you aiming specifically for like programs that were heavy in am care?
So during my PGY1, yes, I mainly applied to VAs, so Veteran Affairs Medical Centers. So the reason for that is the VA is very progressive with pharmacy. A lot of the pharmacists there have provider status. Plus they have pharmacists in all different aspects, not just ambulatory care. And so really PGY1 is meant to hopefully be broad, but I knew VA, I would get more 50-50 split between ambulatory care and inpatient. And so that's why I chose VA. And then in terms of PGY2, so with phase 1, I restricted myself to location, so I didn't really look at the program as better as should I have. So I didn't match phase 1 actually. And so after that, I said, forget the location, time to do it based on the program, which was my approach to PGY1. And so really, PGY2, I still had the goal of academia. Again, not 100%, but I needed a program that did. So looking at the check boxes, essentially coming from the VA, which is completely different healthcare system, I applied for a PGY2 that was outside, that was not a VA, to get experience with commercial insurance, Medicare, Medicaid. I also looked for a program that had academia, but necessarily wasn't super focused. And then also had a lot of flexibility in other disease states that I wanted to see. And so that's how I ended up with the CoxHealth program, because basically it was segmented into 3 sections, which I thought was really nice. So really, one section was primary care and academia. So kind of what I'm doing now is, it was like half my week was spent in the clinic, half my week was spent doing topic discussions, helping give lectures, making exams, things along those lines. Then my second half was a specialty block. So I did some psych, heart failure, endocrinology, transitions of care, which was pretty cool. And then my last block was in a family medicine clinic, which actually kind of worked out. So I had that, and so I was able to work in that residency program and see that clinic and run a phone clinic, which is what I'm doing now due to COVID.
That's awesome.
Yeah, so best advice would say, it's only a year. I didn't think I'd ever go to Missouri. I really enjoyed it though, met some great people. And so it's only a year, so pick the program, not the location.
Yes, definitely. And do you think that you or I prepared you well for your position now?
Yes, definitely. So I would say not only with in regards to the academics and the curriculum itself, I felt very confident in my pharmacotherapy knowledge from URI, especially on the rotations. I do think they have a wide array of rotations too, which kind of helped my trajectory, realizing like, okay, I was able to do a peds rotation and realize peds is not for me, but then also being able to have an opportunity to do an ambulatory care rotation and realizing that is for me. Also, the professors were also very encouraging. I remember sitting down with Dr. Ward my P3 year saying, Dr. Ward, I want to be a professor. What do I need to do? And she basically laid it out. Like, you got to do 2 years of residency. You're already involved in a lot of clubs, so that looks really good. And so the professors were super supportive to ensure I met those goals. And then just in terms of the opportunities for leadership development, because I think that's important if you're looking for residency or a career in academia, you really need to be able to, a lot of times, for my position especially, I'm the only pharmacist there. So I really had to be a leader and advocate for myself. And so having the opportunities to participate and hold leadership positions, not only in pharmacy-related organizations, but also non-pharmacy organizations, I think was just as important. And URI has so many clubs, both in and outside of pharmacy, that really helped me gain the confidence and those leadership skills to get me to where I am today.
Cool, awesome. And my last question for you is going to be, what would be a piece of advice that you would you would tell your past self now? So you're a P2 and you're looking at, careers in pharmacy. What would be a piece of advice that you would tell yourself looking back on it now?
That's a good question. I would say trust the process. Trust the process. The reason for that is I think we all have a set plan. Sometimes it happens, sometimes it doesn't, and it's good to be flexible. And so to trust that you have the knowledge, trust that you got the great experience, and that you'll end up where you're supposed to be.